prevent the spread of the COVID-19 virus, and it's also why we've tested over 17,000 Albertans to date. Let me pause to thank and commend Alberta Health Services officials for their remarkable work on testing, where we are helping to lead the world. Alberta is testing over 2,000 COVID cases per day, over 2,000 individuals to identify whether they have the infection, which is by far the highest per capita rate in North America, and I understand the third highest rate in the world, and that's thanks to brilliant innovation on the part of people at AHS. I want to take a moment to compliment and thank Albertans for their calm and resilient approach to managing the challenges and disruptions that are affecting everyone. And in particular, let me give a shout out to a lot of folks that we don't give enough thought to or credit to, who make things run in our society and whose roles are so important as we face this crisis together. To the truckers who continue to bring food and critical supplies to our stores and our homes. To the grocery store staff who stock the shelves and make sure that we continue to have the supplies that we need. To janitorial staff who are busier than ever, helping to maintain high levels of sanitation from workplaces all across the province. To all of them and so many others, to hundreds of thousands of unsung heroes, thank you for what you're doing to help keep us safe, to help keep Alberta functioning during challenging times. I have a few announcements related to new actions by the Government of Alberta to limit the spread of this disease, including among the most vulnerable groups in our society. And I'll also provide an update on further actions we're taking to deal with the extraordinary economic impact of the outbreak and the simultaneous oil price crash, including actions to protect jobs in the economy and specific new measures to protect our critical energy sector. And in these announcements, I'm pleased to be joined by Minister for Children's Services, Rebecca Schultz, Minister for Community and Social Services, Rajan Sani, and Minister of Energy, Sonia Savage. First, I'm very pleased to announce that starting next week, the Ministry of Children's Services will begin reopening selected licensed childcare centres in order to provide care for core service providers, starting with healthcare workers. Centres will be chosen based on proximity to healthcare facilities and will be reopened in a phased approach. Centres chosen for reopening will be limited to 30 people, including staff, and will have to adhere to strict health guidelines. Children's Services will start contacting those centres for reopening today. Right now, core service providers, including healthcare and municipal critical infrastructure workers, will be at the top of that list, and we will then begin to add other essential services such as police officers, firefighters, correctional service workers, and other impacted sectors. Parents will be notified through their employer if they qualify to send their kids to newly reopened centres. All other licensed childcare centres are to remain closed for the time being. Licensed day homes may remain open, but are limited to 6 children each, not including the operator's own children. I would also ask that if you're a parent who is afforded a childcare space, that you only use it if you have no other way to ensure that you can get to your critical job. We only have a certain number of spaces that are being opened to ensure the functioning of essential services. We all need to operate within this new normal, which means using only the resources that we absolutely need. Next, I'd like to make an important announcement about additional support and protection for the homeless, some of the most vulnerable in our society. This morning, the Emergency Management Committee of Cabinet decided to support an expansion of the network of homeless shelters across Alberta to help them cope safely with the threat of the COVID virus. Implementation of shelter pandemic plans is underway across the province. In Edmonton, Hope Mission and Mustard Seed have identified community spaces to allow extra space between individuals required for social distancing and surge capacity. The Expo Centre will be activated as a location for people with illness. Measures will also be put in place to allow for a separate area of surge capacity for those who are not showing signs or symptoms of COVID-19. Staffing will be coordinated by Homeward Trust and with health services provided by Alberta Health Services. In Calgary, the Mustard Seed and Calgary Drop-In Centre have identified additional sites to meet the shortfall due to social distancing. The City of Calgary and the Drop-In Centre are working with Community and Social Services of Alberta to book hotels for additional surge capacity space. In Red Deer, the Mustard Seed will continue to operate their shelter in their existing location. Safe Harbor will relocate to a larger consolidated centre effective immediately, which can accommodate social distancing and surge capacity. In Lethbridge, the shelter is repurposing space in the current location to allow for the new additional requirements, and the City of Lethbridge has identified other space for surge capacity. In Grand Prairie, the shelter is currently seeking alternate locations. And all of these expanded homeless shelters will be supported by the additional $30 million of support that our government announced earlier this week, part of our $60 million COVID Civil Society Fund. I want to thank the mayors of Calgary, Edmonton, Red Deer, Lethbridge, and other communities for working so closely with us, and Minister Sawhney for acting so quickly to ensure that we do everything possible for the safety of Albertans who do not have a home. Let me now turn to the latest actions that the Alberta government is taking to protect and sustain our economy through this crisis. First of all, by saying that the price war instigated by OPEC and Russia in the midst of this global pandemic highlights the need for Canada, the United States, and other democratic nations to treat energy resources as key strategic assets that are essential to our national economic security. The actions I am announcing today and in the coming days are designed to ensure that our domestic energy industry gets through the price collapse and will assure Canada's security of supply in the long term. First, the Government of Alberta is waiving the industry levy for the Alberta Energy Regulator for 6 months. This action will provide industry relief totaling $113 million. Second, we are extending the term of mineral agreements expiring in 2020 by 1 year. This will bolster certainty in the industry by providing time to raise capital and develop future plans. These actions are in addition to others that we've recently undertaken to protect jobs and incomes in the energy sector, including the recently announced $100 million loan to the Orphan Well Association that will create up to 500 jobs in remediating and completing wells while reducing environmental liabilities, and many other actions we've taken, including the deferral on corporate income taxes, and more measures will follow shortly. Finally, I'd like to announce the formation of the Economic Recovery Council to be chaired by Dr. Jack Mintz. Its task is to think about and provide really practical advice to the Alberta government on the path through this economic crisis, and to think about the mid and long-term strategy for recovery and diversification. To be honest, to be blunt, ministers in our government and senior officials are focused on hour-by-hour and day-by-day crisis management. And that is why we are calling on some of our most respected leaders in business and civil society to help point the way forward for the emergence of Alberta's economy in the long term. I want to thank Professor Jack Mintz for chairing. He is an Edmonton born and raised academic of the highest caliber, the former president of the C.D. Howe Institute, founding president of the University of Calgary School of Public Policy, and one of our country's most highly regarded economists. He is joined by Clive Beddoe, the former chair, president and CEO, the founder of WestJet Airlines, who has a particular insight into the tourism and transportation sectors. As well, Robert Blakely, the former CEO of Canada's Building Trades Unions, who understands the challenges faced by working women and men in this economic crisis. Brent Belsberg, born and raised in Calgary, founder and senior managing partner of TorqueWest Partners, one of the leading financial experts on Bay Street, who has huge international connections in capital markets. Chris Fowler, the president and chief executive officer of Edmonton's Canadian Western Bank, who can bring the perspective of financial institutions and markets. The Right Honourable Stephen Harper, former Prime Minister of Canada, who led Canada strongly through the global financial crisis in 2008 and 9 with one of the strongest economic records at that time in the developed world. Pete Kiss, owner and president of Morgan Construction, whose company has helped to build many oil sands projects, major construction projects, and is really on the front lines of our economy. Zainul Mawji, the president of TELUS Home Solutions, again an Alberta born and raised business leader whose family, who grew up in the hotel business. Her family owns and operates hotels and restaurants, so she understands the hospitality sector, food services, and the huge challenges they're going through now, but is also an expert on information technology and telecommunications. Nancy Southern, one of the most highly decorated and respected Canadian business leaders, the chair and CEO of ATCO Limited. Kevin Ubelein, the chief executive officer of AIMCO, who oversees the management of some $140 billion of assets on behalf of the Government of Alberta, the Heritage Savings Trust Fund, and pension holders. Bob Dillon, the founder, president, and chief executive officer of Main Street Equity Corporation, the second largest owner of rental properties in Canada, who is also one of the, I think, the top performing company on the Toronto Stock Exchange. I want to thank all of these outstanding people for stepping up during this time of great adversity to help guide our province through it and onwards to recover. And I'll just close by saying this. These are extraordinarily busy people, and they are giving of their time freely with no compensation or expectation of it. And this is an example of what I hope we will see coming through this time of adversity. More and more Albertans stepping up to the plate to help their neighbours. And that spirit can be expressed by just going next door to an isolated senior and seeing if they need groceries or pharmaceuticals, by being kind to people in the grocery store, by looking out for your neighbours, and of course by following the advice of Dr. Hinshaw in terms of our public health protocols. Happy to take your questions.
Can I ask you two follow-up questions on the municipal funding announcements today? I know the Finance Minister is talking to municipal officials about further help. Do you have a timeline on when that might be available, and will you consider backstopping them if they decide to freeze property taxes?
Well, there's a lot of questions, Dean. Let me just start by saying that I was on a conference call with, I think, over 200 mayors and other municipal officials this afternoon, chaired by Minister Casey Madhu. And we had an opportunity to hear from officials on a range, municipal officials on a range of issues. I've been in hour-by-hour contact with some of the mayors of our larger cities. We are considering some form of a possible deferral on non-residential property tax. We're trying to design that with municipalities so it does not negatively affect their own cash flow situation. And we will take seriously any requests that they make. Dean, let me just say that while as we roll out response to help with the cash crunch that households, businesses, and municipal governments are facing, we have to be mindful of the cumulative cost of all of that together. It's no secret that our revenues are frankly falling through the floor with the oil price crash and the global recession. And so we need to keep an eye on how much money is on our bank account. We cannot overcommit, but we'll do everything that we can according to the fiscal capacity of the Government of Alberta.
And to that point, you've mentioned that renter legislation to stop evictions. That's a broad brush approach may not work, but would it work to say let's do it for 1 month and then reassess, or is that not feasible?
So we're looking at, with respect to renters, we're looking at options to ensure that people are able to keep have the security of their rental property, even if they are financially distressed. It's one of the reasons we are rolling out the emergency self-isolation payments starting next week of over $1,100 for a 2-week period until people can access a similar federal payment that will be available in the month of April. So that emergency cash should help folks who've had to take time off work to stay at home for health reasons, and as will the expanded federal EI payments. Let me say that I believe any good landlord is going to show flexibility to their tenants now. If it would make absolutely no sense for a landlord to threaten to evict somebody who has no money to pay rent in the weeks to come, because who's going to take that space? So we've already seen many major landlords step forward with more flexible terms, and that's, I think, the preferred path. That's the smart path for landlords. We are in conversations with other provinces to see what they are doing, but if we were to absolutely block any future evictions, that means that even there's a lot of small mom and pop landlords out there who are going to be stressed paying their own mortgages, and if they don't have any revenue, then their financial situation falls into jeopardy. And there's also, as you know, there's sometimes the problem of bad tenants who might be involved in illegal activity or vandalism and things like that. And the landlords must be able to deal with truly problematic tenants. So this is a complex issue. We don't want to make the situation even worse unintentionally. Bottom line is we're giving people that cash infusion, and I think most landlords are stepping forward with relief.
Julia?
Question about the daycares that will be reopening. How many are you looking to reopen, and what's this timeline for the phased approach?
Minister Schultz?
That's a great question. So right now, we based our projections on what other provinces have done and what we've seen happen in other provinces. We are working to open up to 15,000 spaces. Again, we're prioritizing those in areas around the province like Calgary, Edmonton, Red Deer, Lethbridge, Fort McMurray, Grand Prairie, areas where our healthcare workers are already working at higher demand. We are going to have a number of those spaces open, hopefully around 6,000 as soon as Monday, Tuesday, and then continue to open as the spaces are needed. As the Premier said, parents who need those spaces will hear about which centres will be open through their employers, so we can make sure that those spaces are in fact targeted to essential core workers like our healthcare workers or those workers who are working to support municipal critical infrastructure like utilities, fire, police officers, and those types of working parents.
And just a quick follow-up, is there going to be a maximum number of children allowed in each?
Absolutely. And so my department has been working very closely over the last number of days with Dr. Hinshaw's office, and there is not only very specific protocols in place that will be communicated to these centres in terms of temperature checks at drop-offs, for example, a maximum of 30 people in a childcare centre at any time, limits of adults and outside people coming into those centres, as well as, I believe, a limit on how many people can be in a classroom at any time, and protocols for sanitation.
Okay, we'll go here in front.
I have, two quick questions for Mr. Kenny in French.
Do you mind if I take the French at the end? Just for
We won't forget.
Okay.
I won't forget.
Go ahead.
Has there been any conversations around the Alberta Works program, and if that's another option for people?
Well, you're talking about welfare or income assistance. So, look, we fully expect there will be a significant increase in applications and demand for Alberta Works for income support. And I know that Minister Sawney's department, she and her department are preparing for that. We are looking at the eligibility criteria. We'll perhaps be making an announcement in the future. I've said that the requirement that people actively search for work is probably really irrelevant in the next couple of months because of what's obviously happening in the economy. So we are considering some short-term relaxation of eligibility criteria because for the folks who maybe already were on EI, and there might be some people whose eligibility period is about to end on EI. The economy is contracting massively. for a lot of those folks, there just are no jobs out there. So, Minister Sawhney, would you like to add to that in any respect?
Yes, thank you, Premier, and that's absolutely true. We are looking at relaxation of some of the eligibility requirements, but I also do want to emphasize that it is a legislated benefit, and if Albertans are eligible for this program, they will definitely receive those emergency benefits and those income support benefits.
You have a follow-up? We'll go to the phones. Operator, can you put through the first caller, please?
I was wondering why you ladies are so spaced out, and I realize it's social distancing, yes. I mean spaced out in a literal and not a metaphorical sense, to be clear. I hope.
Go ahead, operator, with the first caller, please.
Our first question comes from Chris Barco of the Calgary Herald. Your line is open.
Hi, Premier. I have two questions. The first one is, I ask you, what is the job of the new Economic Recovery Panel in terms of what role do you see it playing? Will it be looking at a long-term restructuring of the Alberta economy? And what role do you see former Prime Minister Harper playing?
The answer is yes. Really, this is a group of super smart people with collectively decades of leadership experience in the Canadian economy who I want to think about the long term. As I said, my preoccupation and that of the ministers and senior public servants in our government is really day-to-day and hour-to-hour crisis management, and that will probably continue for some time to come. And yet we know, look, I've said this before, we're facing a triple whammy, a massive global economic recession. JP Morgan has projected a 14% contraction in the U.S. economy in the second quarter of this year and a 30% contraction in Europe. Layer on top of that the total collapse in energy prices. I see a few minutes ago, Western Canadian Select Oil was trading at $5.60. Citibank is projecting that Brent oil could be trading on average as low as $5 in the second quarter of this year, which would probably mean that we would be paying people to take Alberta oil off our hands. So I don't like, look, I'm not saying these things to cause people to have a sense of despair, but I think it's important for Albertans to be psychologically and financially prepared for what is coming at us. This will be, I believe, the most challenging time in our economy for several decades. So given the depth of those challenges, it is essential that we begin developing strategies for a long-term recovery. And that, of course, the focus of that will be to continue accelerating the diversification of Alberta's economy, but also finding a way forward for our energy industry. And I've told this panel, I met with them by phone for the first time a couple of nights ago. I told the panel I really want them to have absolutely no holds barred approach to this, to think boldly, not to feel constrained by conventional political limitations, to really reimagine what we need to do in the future coming out of this time of serious adversity. And I think Stephen Harper's presence on there is just tremendous, because he's dealt with the only economic crisis of a similar scale in recent decades, and that was the 2008 global financial crisis. So I really appreciate his presence.
Do you have a follow-up, Chris?
Yeah, I do. You talking a little bit about the economy, and I guess what information have you seen, or what projections are you seeing from the government in terms of the scale and scope of the economic contraction that could or will occur and its impact upon employment and jobs in the province?
So far, all we have, Chris, is anecdotal, but let me say that I am fully expecting that the March labor force survey that we'll see in a couple of weeks will be one of the worst records for joblessness in Alberta history. I think we saw the number of unemployment claims nationally go up by I think they had over 240,000 claims just reported, and I think that's just the beginning of this. Obviously, we are seeing massive layoffs as a result directly of the public health response to the virus in areas like the tourism sector, hospitality, and aviation. At the same time, we're seeing very significant layoffs in the oil and gas sector. Even though those companies had already compressed costs because of this price environment, they're further slashing their capital plans for the year. So, Chris, I cannot understate, excuse me, I should rephrase that. I cannot overstate how challenging this time is going to be. I think we are now, here's the some good news is that I think we all expect that after the height of the pandemic, there will be a significant global recovery. J.P. Morgan, that projects a 14% decline in the U.S. economy in the second quarter, projects a 12% increase in demand in the third quarter, and they sort of see that happening globally. But to be honest, Chris, I don't foresee that happening in Alberta, because when we get out of the COVID shutdown, we'll be experiencing the effects of the price collapse on energy. So that is why we'll be doing everything within our power. We're working with the federal government to protect people's financial security, their jobs, and our broader economy.
Operator, can you put through the next caller, please?
Our next question comes from David Staples of the Edmonton Journal. Your line is open.
Premier, I have a question about strategy. So we've taken many steps to shut down society and stop the spread of the virus. Is the purpose of shutting down to give us breathing space so the healthcare system can limit deaths and prepare for the enormity of the outbreak? Or is this more of a kind of a permanent new normal with an idea to suppressing the outbreak in this way for many, many, many months?
Well, the truth is, we don't know. But by taking stringent measures now, we hope to, first of all, ensure that our healthcare system can cope with the peak of infections, and secondly, that this does not have to be the new normal. There is some hopeful data out of China that this week they've had, well, at least a couple of days ago, they had no new cases reported. And we've seen in jurisdictions like Hong Kong, Taiwan, Singapore, and South Korea that very aggressive public health measures ultimately have stopped the growth in the pandemic, and in some of those jurisdictions, they've had very low incidence of infection. So we certainly hope to follow the example of those jurisdictions rather than places like Italy, which and perhaps some of the U.S. states that allowed it to run out of control before taking rigorous measures. As you know, David, the basic public health strategy here is through aggressive measures to prevent the growth of infections so that the peak is below the maximum capacity of the healthcare system to cope. The projections that I've been given by the modelers at Alberta Health Services indicate that we will be below, that we will achieve that goal, that the peak of infections and hospitalizations, particularly in intensive care and those who require ventilator support, will be below the maximum capacity of our healthcare system. That's partly because of prudent planning on the part of AHS, where they have stockpiled enormous inventories of equipment. They ordered 50 additional ventilators when they saw the first outbreak of coronavirus in China. And this is also why we invoked a public health emergency, so that we can better manage human resources in the system for the peak. But that's basically that's the battle plan, which is to constrain the spread so that we're below the maximum capacity of the health system. We believe we are on track for that. Now, our officials believe that peak will be 4 to 5 weeks from now, and then we would probably see several weeks of continued rigorous social distancing measures. And then hopefully, by end of May, beginning of June, we can see some relaxation of those measures. But all of that ultimately will be based on the advice of Dr. Hinshaw.
Do you have a follow-up, David?
Are you confident that that we're building up right now, kind of, not that we're having breathing space right now, but by these kind of stringent measures, we're now taking advantage of that and kind of building up our maximum capacity of our healthcare system, doing enough so that we can take on a lot more.
That's exactly it.
What do you see that gives you confidence?
The strategy is two things. Try to limit the peak of infections as much as possible and maximize the capacity of the healthcare system as much as possible. And we are doing both of those things. The reason for the declaration of a public health emergency was so we could begin planning now to ensure the personnel are in place, adequately trained personnel to operate those ventilators in those intensive care units. And that is also why our government surged $500 million into the health budget this week on an extraordinary basis. And I'll repeat what I've said before, we will spare no expense to combat the pandemic. We will undoubtedly be providing additional funds to AHS.
Operator, can you please put through the next caller?
Our next question comes from James Keller of the Globe and Mail. Your line is open.
Hi, you're expecting to make more announcements on the economic front in the coming days. If you can't give us details, can you talk about the scope of what's needed for the province and its energy sector, particularly when you're comparing this to the Great Depression and that level of crisis? What is the scope of what we'll need?
Well, it's funny. I was in Deputy Prime Minister Freeland's office in Ottawa 8 days ago, and she and I talked about 1 to 2% of GDP as a benchmark for stimulus, countercyclical stimulus in a context like this. And then she and I were speaking a couple of days ago, and we had seen the French government introduce 300 million euros in a recovery package, the British government 330 pounds sterling, which would be like 500 million Canadian dollars in a recovery package. And we also saw the everything else that's happening here. So I don't think we've seen something like this again for at least 70 years in terms of what will be required in action. Now, what's further complicated is this not a normal situation where policymakers can just put the pedal to the metal on fiscal policy, because where would we surge that money into? How do you create demand in an economy that many elements of which are shutting down right now? So our focus right now will be on the liquidity crisis. That's, first of all, cash in the hands of families, but also in Alberta here, uniquely, a liquidity crisis in our largest industry. So we are working with the federal government in that respect. And then simultaneously, we're developing a stimulus strategy. But I think we're going to try to keep powder dry until post-pandemic, so we can surge that extra demand into the economy, hopefully in the summer, where it actually will have a meaningful effect when businesses are reopening and people are getting back to work and buying things again. So then in the longer term, it's about a longer term recovery, and that's why we've appointed this panel.
Do you have a follow-up, James?
Definitely. And what specifically, I mean, you sort of alluded to some of it, but what specifically do you want to see from the federal government? We expect some sort of announcement from Ottawa next week. There's been some talk about orphan wells and fiscal stabilization, but those are not new ideas. So what more do we need from that?
Well, we appreciate the $11 billion of additional credit backstop provided to the Business Development and Export Development Banks of Canada. We are working very closely with the Minister Morneau, with those banks, with the Canadian chartered banks, and the oil and gas industry in Alberta to maximize access to that credit backstop for our producers. And we are in constant discussions with Ottawa on that point. I think the Government of Canada understands that we cannot afford to lose the single largest subsector of the Canadian economy, the largest export industry that is responsible for about 20% of the revenues that the Government of Canada collects, that is responsible for the direct employment of over 250,000 Canadians and the indirect employment of hundreds of thousands of others. Last week, I took to Ottawa the following message, that Ottawa was prepared to save the auto industry and with it much of the industrial heartland of central Canada. In 2008, during the global financial crisis, we need support of that scale and ambition now, and I believe that message is being heard. Let me tell you, yesterday I was on a call with the Council of the Federation, and I was frankly emotionally deeply moved to hear remarkable expressions of solidarity from premiers across the country, including from Atlantic Canadian premiers who are facing enormous economic challenges, who said, Alberta has always been good to us. It's time for the rest of Canada to be good to Alberta. So I really feel that we have a sense of solidarity across the Federation for the unique challenges we're facing.
All right, we'll go back to the floor for the answer in French.
Yeah, so deux questions.
Oui.
Quel est selon vous le danger de la situation actuelle pour l'industrie pétrolière en Alberta? Ça devient peut-être un worst case
Évidemment,
scenario.
oui. On a vu une chute des prix d'énergie le plus grave dans notre histoire. Aujourd'hui, le prix de pétrole albertain est à peu près $6. C'est bizarre. Franchement, c'est bizarre. Et nous croyons que la guerre de prix entre la Russie et l'OPEC va continuer pendant au moins plusieurs mois. Alors ça, c'est la nouvelle réalité. Ça, c'est en addition de 5 ans de récession dans l'industrie énergétique de l'Alberta et la récession globale à cause de coronavirus. Alors, il y en a plusieurs défis très graves. C'est la raison pour laquelle nous avons fait un retard sur les paiements des impôts pour les entrepreneurs, les business. Aujourd'hui, un allègement de frais pour the Alberta Energy Regulator et les autres mesures pour les donner un peu de coup de main.
Ma deuxième question, c'est par rapport aux éditorialistes, à certains leaders politiques aussi en Alberta qui ont posté sur les réseaux sociaux ou même qui ont écrit dans leurs articles des choses qui minimisaient un peu la crise, la pandémie, ou même qui mettaient en doute les informations officielles qui étaient partagées par le gouvernement. Je voudrais savoir ce que vous en pensez.
Moi, je n'ai pas vu ça, mais écoutez, si les gens en doutent de la gravité, si les gens ne croient pas la réalité de cette menace aux santé publique et notre économie, il faut regarder la réalité actuellement en Italie, où centaines de personnes ont perdu leur vie chaque jour. Alors, ça, c'est le résultat d'une politique qui est trop faible en face à cette pandémie, à cette crise de santé. C'est vrai, il y a des gens ici en Alberta qui vont perdre leur vie et nous faisons tout ce possible pour prévenir une situation comme nous avons vu en Italie. Okay, thank you very much, folks.
Folks, just 1 second. We're just going to wipe down the podium to demonstrate patient processes. Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us is Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta, as well Dr. Marcia Johnson, Deputy Chief Medical Officer of Health for Alberta, Paul Winnick, Deputy Minister of Municipal Affairs, and Dr. Mark Joffrey, AHS Vice President and Medical Director for Northern Alberta. Dr. Hinshaw will provide a brief update, as well as a brief update from Deputy Minister Winnick, and then we will open the floor to questions. I'll now turn the floor over to Dr. Hinshaw.
Thanks, Tom. Good afternoon. Thank you all for coming. Since yesterday, we have confirmed 49 new cases of COVID-19. This means that 195 cases have now been identified in our province. We suspect up to 11 of these cases may be community transmission, and I want to be clear, 11 total, not 11 of the new cases. However, investigations are continuing, and these numbers will likely change as more information becomes available. As before, it is only Calgary and Edmonton who seem to potentially be implicated by these cases. 10 individuals are now hospitalized, 5 of whom are receiving care in the ICU, which is 3 additional ICU admissions over the past 24 hours. There have been no additional deaths. The good news is that we're now starting to see numbers of Albertans who have recovered from COVID-19. As of today, 3 individuals have been reported to us as recovered. Other developments to celebrate include the hard work of our health teams. One example of innovation in Alberta is the quick training of many medical students to enhance our contact tracing capacity. There is so much hard work going on at the front lines with public health contact tracing, making sure that every one of these new cases is contacted and anyone who was in contact with them while they were symptomatic gets a phone call and instructions on what to do. I want to thank all of those who are tirelessly working at this task because it is this contact tracing that is helping to contain the spread of this virus. We are also incredibly proud of all of the hard work our lab services have been doing. Worldwide, as you heard earlier, Alberta has been conducting among the highest number of tests per capita. I have been hearing from individuals who are waiting to hear their test results, and I want to assure you that Alberta Health Services is doing their best to get back to you. Staff are prioritizing callbacks to individuals who have tested positive for COVID-19, and it sometimes takes longer to return calls to those who have had negative tests. We are continuing to monitor the development of COVID-19 in our communities, to evaluate our public health response, and to make adjustments and implement new measures to ensure that we are all protecting the most vulnerable members of our communities. Today, we are putting additional measures in place at seniors' facilities. Previously, visitors were restricted to family, friends, or paid companions whose care and companionship was necessary for the well-being of a resident. Now, only a single individual from this group who is designated by the resident or a guardian may visit. Each essential visitor must be verified and undergo a health screening prior to entering the facility. This may include a temperature check or a questionnaire. Facilities must have security staff or a greeter to conduct this screening and verify that the visitor is designated. Exceptions to these essential visitor rules will be made for family members to visit a person who is dying, so long as only one visitor enters the facility at a time. These measures will be extremely difficult for residents of seniors' facilities. While they are necessary to protect our seniors and staff who work with them from the spread of COVID-19, there are additional steps we can all take to make this easier on seniors who are affected. One of the most meaningful actions Albertans can take is simply picking up the phone. Even spending just a few minutes on the phone with a senior can go a long way toward reducing feelings of loneliness and isolation. This is especially important for seniors who are living alone, in addition to those who are in residential care facilities. All of us can make regular phone calls with our elder loved ones a part of our new normal. I know that the measures we have put in place continue to strain families, business, and all of Alberta. I must reiterate their importance. If you are feeling sick with fever or cough or even mild cold-like symptoms, you must stay home and away from others. Those who have returned from travel outside the country must stay home for 14 days after their return, even if they are feeling well. Measures such as restrictions on gatherings and closure of the types of businesses that we have previously announced must be followed. And while those who are feeling well and haven't returned from traveling can be out in the community, be sure to wash hands frequently and stay 2 meters away from others as much as possible. My team and I are receiving many questions about applying these measures to people's daily lives. One question has been about whether it is safe to be outside when someone is self-isolating. I want to be clear that there is no danger to others if someone who is self-isolating goes for a walk outside and stays 2 meters away from others. Being outside and active is an important support for health, both physical and mental, and should be encouraged. With respect to other activities, I know under normal circumstances, many Albertans would be gearing up to visit their local farmers markets this weekend. At this point, these markets are in the same category as grocery stores and shopping centres and can remain open. But again, I urge you to practice social distancing and excellent hand hygiene if you leave the house. Another question we have received is about funerals. For those experiencing the loss of a loved one, funerals may still be held, providing there are fewer than 50 attendees. But you must maintain social distancing. Anyone ill, even with mild symptoms, must not attend. I know it is heartbreaking to refrain from hugging loved ones at something as difficult as a funeral. But please trust that these practices, as painful as they are necessary to prevent the spread of this deadly and contagious illness. Finally, I want to share some stories that Albertans have shared with me through my Twitter account on acts of kindness during these extraordinary and trying times. Stories of neighbors taking the pet of someone in self-isolation to the vet so the animal could receive care, organizations going above and beyond to help travelers get home safely, people taping drawings and paper snowflakes to their window to brighten others' days. And I want to thank teachers for their continued work in supporting students' learning. Others are simply reaching out to people who are struggling, whether it is online or over the phone. Albertans are responding to this extraordinary situation in extraordinary ways. Please continue to share your stories using the Alberta Cares hashtag. Continue to take care of each other and yourselves. The importance of self-care in these uncertain, stressful times cannot be overstated. With that in mind, I will be taking some personal time this weekend to rest and recharge, and my colleague, Deputy Chief Medical Officer of Health, Dr. Marcia Johnson, will provide tomorrow's update so I can spend some time with my family. Thank you for your support as we respond to this serious situation. Thank you for supporting each other. I look forward to joining you again on Monday. Thank you, and I'm happy to take questions.
Dr. Hinshaw.
Sorry, we're just going to have brief remarks from Deputy Minister Johnson. Sorry, Winnick, and then we'll begin.
Good afternoon. I'm Paul Winnick, the Deputy Minister of Municipal Affairs. And as you know, the province of Alberta is facing a major challenge with this outbreak. As part of the government's response, we are making amendments to the Emergency Management Act. The Emergency Management Amendment Act will allow local and provincial states of emergency to exist at the same time should we ever require to declare this. Under existing legislation, the Alberta government, when it declares a provincial state of emergency, takes charge of all local authorities. This effectively nullifies the local declaration and response, since two emergency declarations cannot exist at the same time. Amending this section of the Act will help communities and the province respond to emergencies according to their respective levels of responsibility and expertise. This amendment provides clarity and improves the coordination of local and provincial response efforts in the event of disasters, not only the current pandemic, but should there be wildfires or floods in the future. And of course, beyond the COVID-19 outbreak, Alberta has now entered the natural disaster season. Allowing individual communities to run their own states of local emergency will ensure the province is ready and able to respond to additional emergencies and disasters should the need arise. Alberta has been through significant emergencies and disasters in recent years, including major floods and fires. Because of these experiences, we're able to work seamlessly with our emergency partners across the province and across the ministries. The Amendment Act will help to ensure the best possible response at all levels of government to the challenges that we face now and in the future. Thank you.
All right, we'll now open to questions. We got Dean and then Tricia.
Dr. Hinshaw, two topics, if I may. One is the ICU cases. Could you put some more information on that in terms of the circumstances of them? Mm-hmm. And is there anything we should draw from 5 ICU cases out of 190? 5 cases altogether.
So I have basic information only. As you know, things change very rapidly, and so we're drawing our data summaries now through our administrative databases because, as you know, with this many new cases, it's impossible for me to get a personal phone call with a description of each of those cases. The information that I have at this time is that we have one case in their 40s and one in their 60s. Those were 2 that had previously been reported. Of the new ICU cases, I believe one is in their 70s, one in their 60s, and one in our administrative database did not have the age recorded, which again, sometimes the investigation takes a while to then populate through our systems. I think what I would say is that we knew this would happen. This is why we're taking these extraordinary measures. This shows that this is a virus to be taken very seriously. We continue to do everything we can to prevent every single case, and every single case is one that could potentially end up in a serious condition. And so, again, while we only have these 5 right now, again, it's a signal that we need to take this extremely seriously.
A question for Dr. Goffey. Can you update us now on the Bonspiel doctors? How many Alberta doctors was it? Have they been notified? Are they now self-isolating? And do you see, given the specialties they have, that this could have any impact on fighting COVID?
So that investigation continues to be underway. So I'm working on getting the additional details. My understanding is that today Public Health is getting those lists and contacting all of those doctors individually who may not have heard the public appeal, and making sure that not only does the organizer, who I think has reached out to all those individuals, that Public Health actually has their contact information and has an individual conversation with each one of them. So that's happening today.
You might be having these Bonspiel doctors out there practicing today.
So again, my understanding is that the organizer has notified everyone of the requirements, but Public Health does need to do that individual notification. So again, I would hope that the doctors who are in the situation are following the recommendations, and we're going to make sure that they understand that. But again, it just takes time. We were notified of this yesterday. We're getting the list. We're making those phone calls. But it's really only been a little over 24 hours since we were notified.
Tricia?
Sort of following up on that, we've gotten a few tips about people in quite high up positions at key facilities that might have been there. Is there any concern about exposure for patients or anything?
That's a part of the investigation that's happening right now. So obviously, if someone was there, became ill and worked while ill, that would be a significant concern, but I don't have those details. That's something that we're investigating.
Excellent. One more, and then we'll go to the phones. Dylan?
We saw just about 95 cases or so in about the first 12 days. In about the 2 or 3 days since, we're now at 195. Are these numbers surprising, or is this sort of par for the course?
So the majority of our numbers are still from people who've traveled from outside the country, or those who are close contacts of those people. So I would say that this is, again, evidence of that public health containment in action. So many of those close contacts are people that we had notified, informed them to be on self-isolation, and when they became sick, they were tested and were confirmed. So again, the measures that we're taking are really those to contain that. So of all of those cases that I talked about, again, our number today is 11. I think that may change a bit as we do investigation, and we may find a connection that wasn't immediately obvious. But certainly it's concerning. Every single case that we get is one that needs to be contained. And the ones that are most concerning are the ones that are showing up that haven't been staying home while ill and have put others at risk. So again, over and over again, that key message: when anyone is sick, they must stay home.
So we'll go to the phones, and we'll definitely come back to the room. Operator, could you patch through the first question?
Our first question comes from Emma Graney of the Globe and Mail. Your line is open.
Yeah, g'day. I've got a question and a follow-up here. We're hearing of a possible case at an Alberta oil sands camp. Now, I understand you can't give specific details, but I'm wondering if you can speak a little bit to the worries you might have around these places that are close living quarters. They have buffets. They're at risk, really, of spreading germs pretty easily. What's your advice to them?
So with respect to work camps, there certainly are measures that those places can put in place, especially with things like a communal dining area. And so they can have people potentially eating in different shifts, sitting apart from each other at tables. Buffet-style serving should be discouraged, so there shouldn't be a common handling of serving utensils. So there may be changes that are required in those places, but certainly there are measures that they can take to reduce the risk. With respect to you indicated there might be a report. That's not something that I have heard. I'm not aware of a case in the work camps. So again, I know that local public health, when they do get cases, they do that investigation. And if there were to be significant risk beyond immediate close contacts, we've asked for local public health to notify us, and that's not a notification I've received.
You said you had a follow-up there, Emma?
Yeah, I do. Now, this actually moves over to the change they made with the state of local emergency. I'm just curious there, whose direction is the most powerful? Will provincial direction override local direction? Because you might have some municipalities where, for example, you know, the town council is convinced it's all a hoax, doesn't really exist, and so therefore they're not willing to do anything. Would the province direction override that silliness?
In that case, and I don't think we would ever run into that case, that extreme example that you've mentioned, but absolutely the provincial direction, if there is a discrepancy, would override local direction, but we would work very hard to ensure that things are synchronized.
Excellent. Operator, could you pass through the next question, please?
Our next question comes from Myrna of CBC Radio. Your line is Canada.
Actually, sorry, someone just asked my questions. It was about the workers' camp. I'm good.
That's no problem. Operator, could you patch through the next question, please?
The next question comes from Kevin Nimick of CTV Calgary. Your line is open.
Hi, Dr. Hinshaw. I have a question and a follow-up. So today we learned a staff member at a Calgary McDonald's contracted COVID-19. Is it still safe to buy food from restaurants, be they fast food or dine-in?
So again, I'll say that I don't have that specific information. I know you're not asking me to confirm that case, but I would caution all of you, if you're getting reports, that sometimes those reports are simply of someone who is sick and is being tested, and they may not actually be a confirmed case. So just that caution in terms of verification. With respect to the safety of eating food from restaurants, so this is not a foodborne illness. So one of the things that if people want to be as safe as possible, we talked, I think, in a previous media availability about, is it safe to order in food from restaurants? So we talked about the fact that if you order in food, to be absolutely safe, you can transfer that food into your own dishes, wash your hands. But again, the likelihood that you would be exposed to COVID through the packaging would be very low. With respect to going into restaurants or going through a drive-through, for example, again, the virus is not foodborne. So again, to be absolutely safe, ideally you would wash your hands before eating the food or use hand sanitizer immediately before eating the food, and then it would be safe to do so.
And there was a follow-up?
Yeah, so do you have a timeline in mind for when we will know if efforts to isolate and socially distance are working?
So the virus has an incubation period of approximately 2 weeks. Most cases occur within 5 to 7 days of an exposure. They can occur a little earlier or a little later. So we would expect that the impacts of the social distancing measures that we've taken over the last week, that we would see those impacts with respect to community spread after about 2 weeks have passed. And we would need to sustain those for another several weeks as we monitor the situation, because this virus is not going to be rendered ineffective by these measures. We're simply slowing down the spread, stopping it as much as possible. And so we do need to be prepared that these measures will be in place for weeks to come.
Excellent. Go back to the room, Julia.
What changes are you anticipating with the closure of the Canada-U.S. border effective midnight in terms of number of cases and suspected community transmission cases?
So we know that the United States has been the #1 source of our imported infections, and that's come from various different states. So that closure of that border to non-essential travel by mutual agreement is critical to reducing the number of new imported infections we get. I think that another critical piece will be making sure, though, that we continue to have supply chains running, because if we aren't able to get supplies, that would be a challenge. We know that we've created exemptions so that trucking companies can continue to run, and I know that's been something with that border closure that's been made very clear, is that supply chains will continue. So again, that's the important piece about the border closure will limit the majority of the traffic, but essential traffic will continue so that we can have our essential supplies.
And as the number of cases of community transmission seems like they're continuing to rise, and with the border closing and different travel restrictions in place, do you anticipate any changes to the criteria for testing and screening?
So as I've talked about before, that is something that we're looking at, and we right now again feel that people who are coming from outside the country have the highest probability of being infected if they're coming from areas where we know transmission is occurring. We also know that the testing that we're doing right now, so we are testing, again, I mentioned anyone who's hospitalized, any of our outbreaks, long-term care facilities, certain family physicians who are sentinel surveillance. So we're doing that testing already and making sure that we do have some of that background testing happening. We're discussing whether or not we may want to shift, and there's been discussions at a national level looking at how we would prioritize, because as I've said before, we will never be able to test every Albertan with a cough or fever. And so we want to make sure that we're allocating that scarce resource of testing in the best way possible. I know I've been talking about that for several days, and the reason it's not an immediate decision is because it is complex, and we want to make sure that we're allocating those testing resources where it provides the most benefit to the population.
Excellent.
49 new cases was our biggest jump to date so far. I'm just curious if you have, I know it's hard to predict and it's a new virus, but do you have projections on how many Albertans may contract the virus at some point? Is it in the thousands, 10,000s perhaps?
You know what? That depends on us, right? So I think the total number that will eventually contract the virus depends on our ability to prevent the spread. And so it's very difficult to give a firm number in terms of how many will eventually get it, because all of the measures that we're currently putting in place are designed to lower that as much as possible. So at this point, it's extremely difficult to predict.
And sorry, a follow-up. You said we've had 3 people recovered, but now that they're most likely out of self-isolation, is it possible to catch COVID a second time around?
So what we know from case reports in other countries is that sometimes people will test positive, have a nose swab that tests positive after they've recovered. But what's not clear is what that means, because I'm not sure if people understand that the nose swab test, what it does is it sort of looks for kind of the presence or absence of the virus, but it can't tell whether or not the virus is live and viable. So some people may have copies of genetics of the virus in their system for many days after they've recovered. But what looks like from some of the studies that have been done where they've actually taken that virus from those swabs and then tried to grow it, tried to culture it, it looks like from some of those studies that it's about an 8-day maximum after the start of symptoms, especially for people who have mild illness, that the virus is actually viable or alive. So these cases where you hear of somebody who's well and then gets tested and is positive again, it's really difficult to say if perhaps they just are still shedding virus, that's dead virus. And because this is still so new, we actually don't know the firm answer to that question. We would expect, from what we know from other viruses, that people would have some kind of at least short-term immunity. But this is still so new, we can't say with certainty.
Excellent. We'll go back to the phone, and then we'll come back to the room. Operator, could you patch to the first question?
Our next question comes from Rosa Saba of the Toronto Star. Your line is open.
Thanks. Actually, my question was for Kenny, so go ahead. Thanks.
Excellent. Operator, could you patch to the next question?
The next question comes from Tyler Dock of the National Post. Your line is open.
Hey, guys. I just wanted to ask about the cases in Calgary. It seems like the most of the cases have been in Calgary, and so I wanted to ask if you have any concerns with the Calgary International Airport being one of the 4 destinations for international travelers, and whether or not there's concerns that that should be taken to a different international airport.
So with respect to the cases in Calgary, I think anyone who's coming from outside the country has a higher risk of being exposed, and we know that Calgary has more international travel coming into that particular city, and that's one reason why the numbers are higher. Another reason why the numbers are higher is that there was one particular cluster of cases I've talked about before that has at least, and we're still trying to count up the numbers, but that particular group has at least 34 cases associated with one gathering, and then some onward spread from some of the people who were infected. So if you look at the Calgary numbers, again, 34 of those was one particular incident that has spread. So it's not necessarily an indication of greater risk in that community. And again, I want to emphasize that when we find those cases and make sure that they're isolated, that's how we prevent that further spread from happening. So with respect to whether or not Calgary should be that destination airport, I think it's not, I would not say Calgary is at greater risk than Edmonton or any other place in terms of having that airport as the destination. We know that Alberta Health Services staff have been in the airports for the past several days, making sure that returning travelers get accurate information about what's expected of them, why they need to self-isolate, what they need to do to properly maintain self-isolation. And so I think whether it's Calgary or Edmonton, those international travelers need to get that accurate information. And so I don't know that it really makes much difference which of those two airports was selected.
Excellent. Come back to the room for the final two. We got Tricia and then Julia.
You touched earlier on some people not complying that may have come back and traveled. They had seclusion orders, but they were breaking them. Can you talk more about that? And you had touched on working with the Justice Minister as well. Do you know where that's at?
So yesterday I did get some questions about compliance. And so there's two pieces of that. One is that question of people coming back and not self-isolating. And so what we have done is worked with the colleges, all health professional regulatory colleges in the province, to make sure that they're willing, if any of their members is not following appropriate public health guidance, that they are very happy to follow up with those members and remind them that it is a professional obligation to follow these directions. So if somebody does see a member of a regulated health profession who is not following the guidance, the direction to self-isolate after returning from international travel, they may want to talk with the person, make sure the person is aware. I'm not encouraging people to report them just right away, but if they feel that this person is knowingly violating and putting people at risk, they can call that person's regulatory college. Each college has a public-facing phone number, and then the college will enforce the need for that person to follow these guidelines.
And have you been hearing about that outside of the one lab tech in Calgary, the dental lab?
So the one case that was reported, I think it was yesterday that we were hearing about, was a dentist. And then Alberta Health Service was able to work through that process. But what we want to make clear is that the best place for people to go is, again, those regulatory colleges. So I haven't necessarily been receiving lots of reports of those, but we did want to make sure that people knew where they could go with those concerns. So that's one piece of it. The second was the work with the Ministry of Justice, and that's more about the closure of places, the restrictions on schools, daycares, and then other public places, other businesses. And so that enforcement process is still being worked out, but we are close to having an agreement.
Will there be something for people who want to report people who aren't abiding by these rules, that don't have regulatory colleges that they report to or anything like that?
So I'm not sure that we're going to be able to set up a phone line for the average Albertan to call in. Again, I would really encourage people to remind, if they see someone who isn't following the guidance, to remind them that this is not something that they should take lightly, that really staying home is saving lives. That's the bottom line. And if that person needs supports to be able to do so safely, what are the supports in that community that can help them? But I don't think we'll be setting up a phone number for reports on average Albertans.
Julia, final two.
Just on that note about potential enforcement of people who aren't self-isolating, I noticed Saskatchewan is now going to give out a $2,000 fine for people who aren't following local orders. Do you see Alberta following suit when it comes to that?
So we are having conversations about what kinds of measures we might take with respect to following up with people who are not complying with the direction. But no decisions have been made. Again, we really have been focusing on the fact that this is something that all of us, all Albertans, need to take seriously. One of those pieces is if someone's returned from outside the country, staying home for 14 days. But another one, even if people haven't traveled, I really want to emphasize, and this is not something that we would be able to enforce, but if someone is feeling sick, even mild cold-like symptoms, cough or fever, they must stay home and away from others. And that's something that, again, we will never be able to write tickets for, but we're encouraging Albertans to support each other to make that right choice.
And just to follow up, I feel like we're hearing lots of different things from the Prime Minister who's saying stay at home. We hear here social distance, but we also have mass gatherings of up to 50 people, and they all sort of seem to conflict with one another. So how do we cut through that? And specifically, what should people be doing?
So absolutely it's challenging, and different provinces and different parts of different provinces are in have different circumstances. So I think when the Prime Minister is creating advice, trying to make that appropriate for every part of the country, that's challenging. In Alberta, we're looking at our local situation and trying to make that decision to balance the right thing to do for public health while not completely shutting down our social structure. We know that whatever measures we put in place, we will need to sustain them for weeks, if not months. And so, again, we're, as I mentioned yesterday, wanting to balance those two parts of our key pandemic objectives, reducing the impact on people, reducing the damage that the virus can cause in terms of ill health and death, and also making sure that we're not overly disruptive to society when it's not necessary. So I completely understand people can be confused because different provinces are doing slightly different things, but each of those decisions are made with the context of that province, what the situation is like in that province, and what's best for that particular population. So that's, I know it can be confusing, but I think, again, we're trying our best to balance for Albertans the right thing to do while we're constantly reviewing our current evidence.
All right. Thank you for coming, everyone. A reminder of tomorrow's update will be provided by Dr. Marsha Johnson, Deputy Chief Medical Officer of Health for Alberta. Thank you for coming.
Thank you.